Hello everyone, welcome to my YouTube channel Pharmacy Wit. So the today's title is calculating doses, dosages and quantity. So let's start with the definition of posology, dose and dosage. So let's start with posology. What is posology? It is the branch of dosage, or from the Greek word posos means how much and logos means study. It is the branch of medicine that concerned with the determination of appropriate doses of drugs. Next is dose and dosage. Dose of a drug, it is the amount or a quantity which is administered to the patient, and it is usually taken at a one time or during the specified period of time. That specified time, for example, per day. And dosage refers to the determination of and regulation of the size, frequency, and the number of doses. Dosage R refers to the entire regimen or schedule of doses. The term dose and the term dosage have slightly different connotation. The dose refers to the quantity of drug, and dosage implies the treatment duration and cumulative effects. Next is doses may be expressed as single dose. It is expressed as a daily dose, and it is expressed as a total dose. A daily dose in turns may also be expressed as divided dose. Single dose, the amount which is taken at one time. Daily dose, the amount which is taken during 24 hours. And the total dose, it is the amount which is taken during the course of treatment. As I told you before, daily dose are also expressed as a divided dose. So what is divided dose? The dose which is subdivided into two or more times per day. That is divided dose. Now next is, let's understand this single dose, daily dose and total dose with an example. First example is a dose of 50 mg is prescribed once daily for 10 days. So in this question, single dose and as well as the daily dose are same, which is 50 mg. Because it is written in the question 50 mg is prescribed one time daily for 10 days. So daily dose is also be 50 mg, and what will be the single dose? It is also be 50 mg. So we have to calculate the total dose. So what will be the total dose in this question? As we know that the total dose is the amount which is taken during the course of treatment. So what will be the amount or a drug which is prescribed to the patient during the course of treatment? It is in the question that the 50 mg dose is prescribed one time daily for 10 days. So 50 mg drug is prescribed to the patient per day, means one time in a day for 10 days. So what will be the total dose? It will be 500 mg. Multiply both of them, you will get 500 mg. That is the total amount of the dose which is prescribed. Now the next example is a dose of 500 mg 3 times daily is prescribed for 7 days. In this question, 500 mg drug it is prescribed to the patient in a one day 3 times for 7 days. So what will be the single dose here? Single dose will be 500 mg. But here the daily dose is different because this dose is prescribing 3 times per day. So it is prescribing 3 times. So we have to multiply with 3. So what you will get? 1500 mg. So this is the daily dose which is prescribed. Now you have to write it down what will be the total dose. So you have to think here, read the question carefully, that a dose of 500 mg it is prescribed for 7 days. But what will be the daily dose? So this 1500 mg is the daily dose which is prescribing to the patient for 7 days. So how you have to calculate the total dose? 1500 mg of the dose is prescribed to the patient for 7 days. So you have to multiply it with 7. So what you will get? That is 10,500 mg. So this will be the total dose prescribed to the patient. Now next is, what are the factors influences the dose of a drug? Doses and dosage regimens, they are highly variable among substances. Each is determined by a drug's biochemical and as well as the physical properties, and also the route of administration and patient factors. A dose may be based on age, body weight, body surface area, and also the overall health of the patient, like the liver function, kidney function, or the specified condition that being treated. And also, prescription recommendation may be based on the clinical trials, the studies, or the manufacturer's guidelines. So the optimum dose of a drug, it will vary from person to person or a patient to patient. Here I will write it down, the following factors that influences the dose of a drug. First factor is age. Second factor is sex, that influences the dose of a drug. Third factor is body size. Fourth factor is route of administration. Fifth factor is time of administration. Sixth factor is environmental factors, psychological factor or psychological state. Eighth factor is pathological state or pathological factor, and then accumulation. Next factor is drug interaction. 11th factor is idiosyncrasy. Next factor is genetic diseases, then tolerance. So these are the following factors that influences the dose of a drug. So let's understand one by one these factors. Let's start with the first factor, which is age. So the first factor that influences the dose of a drug is age. Human beings, they can be categorized into the following. So they categorized into the groups. As you can see here, the tables, so accordingly they categorized into that groups. So the first one is neonates, that we are calling from the birth to 1 month. Second is infant, that is from 1 month to 1 year. Early childhood, 1 year through 5 years. Late childhood, 6 years through 12 years. Adolescence, 13 years through 17 years of age. Then adult. Then elderly patients or old patients. So as we know that the age are affecting the dose of a drug. In children's, the enzyme system in the liver or in a renal excretion remain less developed. So because of this, all the doses that should be administered to the children, they should be less as compared to adult dose. So this is one of the example. If you are talking about the elderly patients, so for elderly patients, the renal function is not good in the elderly patient. The renal function is decreases, and also the metabolism is also decreases in elderly patient, and the drug absorption from the intestine are also slow in the elderly patient. So in that patient, the dose should be less as compared to the adult dose, and also it should be judicially administered. So this is how the age is influences the dose of a drug. Now the next factor is sex. So if your patient is male or female, it is affecting the dose of a drug. For example, if you are talking about female or a woman, during these three conditions, menstruation, pregnancy, or lactation. So special care should be taken when you are administering the drug to the woman during these three conditions. So for example, like some drugs are not prescribed, are not to be taken, or you can say that prohibited in pregnancy, menstruation or lactation. So for example, like strong purgatives, and they should not be given during the menstruation and as well as pregnancy. And another example is anti-malarial drug and ergot alkaloids. They are also should not be given during pregnancy. Why it is not given during pregnancies? To avoid the deformation of fetus. Next example is antihistaminic and sedative drugs and they are also not be taken during pregnancy because these drugs are secreted in the milk and the child may consume them and it will harm to the fetus. Now the next factor is body size. Actually the body size, it influences the concentration of drug in the body. The average adult dose is calculated for a person with 70 kg of the body weight. For exceptional, if you are talking about the obese, that is a fat patient, or a lean, that is thin patient. So these are the exception. but the average body weight of the adult is 70 kg. Another method for dose calculation, it is according to the body surface area. Now the next factor is route of administration. So as we know that what are the route of administration, means by which way that you are giving the drug to the patient, by oral route, by intravenous route, that is a parenteral route, by sublingual route, by transdermal route. So these are the etc. These are some route of administration. In case of IV injection, the total drug reaches immediately to the systemic circulation. Hence, the dose that to be given by the IV injection should be less as compared to the oral route or any other route. Because all the drug in IV injection reaches to the systemic circulation. That's why they are having 100% bioavailability. Now the next factor is time of administration. Time of administration is also one of the important factor and which influences the dose of a drug, because the drugs are most quickly absorbed from the empty stomach. So the presence of food in the stomach, it will delay the absorption. For example, so some drugs have to be given at a particular time. For example, potent drugs, they have to be given before meal. And irritant drugs, they have to be given after meal. Why these irritant drugs have to be given after meal? So that the drug is diluted with the food and thus produces less irritation. So that's why it is preferred to give after meal. Okay. Now the next factor is environmental factors. Environmental factors, like when you are taking the drug, like at a daytime or at a night time, or as well as in a winter or a summer. So these comes under the environmental factors which influences the dose of a drug. For example, stimulant type of the drugs. What are the stimulant drugs? Which increases the activity of central nervous system. For example, caffeine, nicotine. So these type of the drugs are taken at daytime. And sedative types of the drugs, they are taken at night time. So when the dose required for the sedative for daytime, it will be much higher as compared to the night time. Another example is alcohol is better tolerated in winters as compared to the summer. Now the next factor is psychological factor or psychological state. So psychological factor or psychological state of mind, it is very important, that influences the dose of a drug. Actually, the state of mind of the person or a patient, it will affect the response of a drug. So this psychological state of mind, it will affect the response of a drug. For example, nervous and anxious patients, they require more general anesthetics. So the another thing is placebo. Do you know the meaning of that placebo? What is placebo? Placebo is an inert substance that does not contain any drug and it is designed to have no therapeutic benefits. So this placebo effect is when the person has response to the fake treatment, but it is not contain any drug and also do not have any therapeutic benefit. Some placebo examples are lactose tablet and also the distilled water injection. So sometimes patients often get some psychological effects from this placebo. So placebos are more often used in clinical trials of the drug. Now the next factor is pathological factor or pathological state. Pathological state means that is the presence of disease. So there are several diseases which affect the dose of a drugs. For example, gastrointestinal diseases like achlorhydria. Achlorhydria is the condition which reduces the secretion of HCl acid in the stomach. So in this condition or in this state, the absorption of aspirin decreases. Another example is liver diseases. Liver diseases like liver cirrhosis. In this, metabolism of some drugs are reduced. The drug example like morphine, phenobarbital, etc. In this condition, the metabolism of these drugs are decreased. Another example is kidney diseases. In this condition, the excretion of some drugs are reduced when you are administering these drugs. So some drugs, for example, digoxin, phenobarbital, and aminoglycosides. So these are the drugs in the kidney diseases condition or patients who is having a kidney diseases. So excretion of these drugs are reduced so that the less dose of the drug should be administered to that patient. Next factor is accumulation. Any drug will accumulate in body if, in which condition? If only rate of absorption is more as compared to the rate of elimination. So a rate of elimination is less and rate of absorption is more. In that condition only the drug is accumulate in the body. So there are some drugs who is slowly eliminated, they are accumulated in the body and causes toxicity. So the drugs who is accumulated in the body, they causes the toxicity. These drugs are slowly eliminated from the body. For example, the prolonged use of chloroquine. So the prolonged use of chloroquine, it will causes damage to retina. Now the next factor is drug interaction. It is a situation in which a substances, usually another drug, it will affect the activity of a drug when both are administered together. So drug interaction, it is a change in the action or a side effect of a drug caused by a concomitant administration with a food, supplement or any other drug. So simultaneously administration of two drugs, it will result in same effect, decrease effect or increase effect. You can see the table here, so it will shows you the one side, the left hand side will show you the combination of drug A and B relationship and also the effect of both of the drugs and what is the name of that effect, and the next column is the examples which shows this effect. For example, the first one, the effect of both the drugs A and B is equal to the effect of A plus effect of B. It is called additive effect. For example, aspirin with paracetamol. Next relationship is if the effect of A and B drug, it is more than the effect of A and effect of B. This is called synergistic effect. For example, sulfamethoxazole and trimethoprim. Third relationship is the effect of AB is less than the effect of A and effect of B. This is called antagonism. For example, histamine and adrenaline. So this is the drug interactions, their relationship and their name of the effect. Now the next factor is idiosyncrasy. So it is the abnormal physical reaction by an individual to a food or a drug. It is an exceptional response to a drug, but in a few individual or in a few patients. So these responses or these exceptional responses are not shown in all patients. These responses are only shown in a few individuals, in a few patients. For example, in some patients, aspirin, it will causes asthma, only in some patients, and penicillin, it causes irritating rashes on the skin. So these are called the exceptional responses, which is noted down in a few patient. It will not shows to all the patient. Okay, it is not a common response or it is not a common reactions. It is a exceptional responses or a reaction which shows in a few individual, in a few patients only. So this is called idiosyncrasy. The next factor is genetic diseases. So some patients, they have a genetic defects. So in that condition, they lack some enzymes. So in those cases, some drugs are contraindicated. For example, the patient lacking glucose 6 phosphate dehydrogenase enzyme. So if the patient is lacking and they are having a genetic disease. Because of that, they will lack this enzyme. For these conditions, the patient who is lacking this glucose 6-phosphate dehydrogenase enzyme, so for that, the primaquine should not be given to that patient because it will causes hemolysis. Hemolysis means the destruction of RBC, red blood cells. Primaquine is an anti-malarial drug. So this is one of the example that how the genetic diseases will affect the dose of a drug. Next factor is tolerance. Tolerance is also one of the factor which influences the dose of a drug. Sometimes higher dose of drug it is required to produce the given response. But previously the less dose was required. Now the tolerance are categorized into, the first one is natural tolerance. So what is natural tolerance? Some races are inherently less sensitive to some drugs. Example, rabbits and black race, they are more tolerant to atropine. Second is acquired tolerance. So by the repeated use of a drug in an individual for a long time, it required larger dose to produce the same effect that was obtained with the normal dose previously. So that is acquired tolerance. The third is a cross tolerance. It is the development of tolerance to the pharmacologically related drugs. Example, alcoholics are relatively more tolerant to the sedative drugs. The fourth one is tachyphylaxis. So tachy means fast, phylaxis means protection. It is the rapid development of the tolerance. When a doses of a drug are repeated in a quick succession, a reduction in a response occurs. That is called tachyphylaxis. So this is usually seen in ephedrine. The next is drug resistance. Drug resistance, it refers to the tolerance of microorganism to the inhibitory action of antimicrobials. Example, staphylococci to penicillin. These are all the category under the tolerance factor and how the tolerance will affect the dose of a drug. This is all about. I have some learning assessment questions for you. So it is here, you can solve it and you can write your answer in comment box. Stay tuned for next video and do like, share and subscribe.